I'm Ashlee Powers, and this is my volunteer, Cody Johan, and we are going to be administering the Western Kentucky University Motor Speech Examination today. Okay, first we're going to test oral peripheral structure and function. Cody, can you turn your head to the left, to the right? Okay, everything looks symmetrical. Next, we are going to test the mandibular structure. Can you turn your head to the right and keep it there? Okay, to the left. Okay, mandibular structure looks symmetrical. Okay, next we're going to test lip structure. Can you please pucker your lips? Good, lip closure. Can you please smile? Frown. Okay, good. All right. Good range of motion on his lips and good lip closure. Everything looks normal. Next, we're going to test tongue structure. Can you stick out your tongue? Okay. Can you move your tongue from side to side? Good. Can you move your tongue up and down? Up and down. Okay, good. Good range of motion on his tongue. Everything looks normal. Can you stick out your tongue one more time? You do notice that he has a little bit of a geographical tongue, so that'll be very interesting when we do the taste testing. Okay, next we are going to look at dentition. Get out my flashlight. Did you have braces?
Yes.
Okay. Have you ever had any teeth pulled?
No.
Okay. His teeth look very good, nice and straight, pretty. You can go ahead and stick out your tongue too. Okay, good. Have you had your wisdom teeth taken out?
One of them.
Okay. Do any of the other ones ever bother you? Okay. Dentition looks good, and you don't have dentures, correct?
Correct.
Okay. All right, next we are going to look at the hard and soft palate. We're going to use the flashlight again. And I'm also going to test your gag reflex. Okay. Open your mouth wide. Okay. Can you get in there with the camera? Okay. So we're up here. See, you're good. Good. Okay. We have the hard palate, which right here. And then stick your tongue out. The soft palate, which... Okay, yep, there was the gag reflex. So it goes all the way back. And everything looks nice and symmetrical in there as well. Good job. Okay, next we are going to test velopharyngeal function. I'm just going to stick this mirror underneath your nose while you say some sounds, okay? Say, Okay. No nasal emission on that. Say, Okay. No nasal emission on that either. Okay, next we're going to say humbug.
Humbug.
All right, looks good?
Humbug.
Good. Okay. Next, saliva control. It doesn't seem like you've been having any problems. Do you think you have any problems controlling your saliva?
No.
Okay. Do you feel like you get out of breath when you talk?
No.
Okay. Now we're going to check out the ears. Can you turn your head to the right, please? Everything looks good on that ear. Okay. Good. Anything bothering you with your ears?
No.
Okay. All right, so that completes the oral peripheral structure and function part of the exam. Next, we're going to move on to cranial nerve function. Okay, first, I'm just going to tell you some different directions, and you're just going to do them. The first thing we're testing is the trigeminal nerve. Okay, can you open your mouth and close it slowly? Looks good. Okay, next we're going to open mouth against resistance. So I'm just going to put my hand right here. Okay, good. Okay, so you're going to do this next. It's going to protrude and retract your jaw, so just go like this. Okay, good. Next, you're going to move your jaw laterally, so like this. Good job. Click your teeth together. Normal. All right, next I'm just gonna rub the masseter muscle, which is right through here. Does this ever get tense? Does this feel normal to you?
It feels normal.
Okay. Good. Okay. Can you tighten the muscle under your chin by just tensing right here? Good. All right, next I'm just gonna test the sensation on your forehead, cheeks, and jaw by running a Q-tip along it. And tell me if anything feels unnatural. Did you feel that?
Mm-hmm.
Did you feel that?
Mm-hmm.
Okay, cheeks. Did you feel that?
Mm-hmm.
That? Good. All right, jaw. That? That? Okay, good. All right, now can you say, just repeat after me. Papa, 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 pa.
Papa, 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 pa.
Good. All right, that was about 12 syllables, so that's really good for 5 seconds. All right, so next we're going to test the facial nerve. This, we've already kind of tested his facial symmetry when he turned his head from left to right, and that was normal. Can you wrinkle your forehead for me like this? Okay, good. Move it up and down like this. Good. That produced some good wrinkles. All right, close your eyes tightly. Good. Okay, pucker your lips again. Good. Smile. Awesome. All right. So show your teeth like this and pull down hard with your corners of your mouth, almost like a growl. So, okay, that one's kind of hard, but it looks normal. All right. Can you put some air in your cheeks like this and move it from side to side? Good. All right. Now, I'm just going to use this pen and put it in the side of your mouth as so. And you're going to say papa, 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 pa. The same thing you did, but you're going to be having this in your mouth.
Pa, 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 pa.
Good job. We used a bite block for that one to make sure there's no damage of the trigeminal nerve that the facial nerve is compensating for. So that was really good. All right. Next, we are going to do the taste test portion. Good? Mm-hmm. Okay. We are going to do sweet first. And I'm going to put on some gloves for this portion of the test. Okay, so pretty much what I'm going to do is I'm going to dip this Q-tip in some different things. We're going to do sweet, sour, salty, and bitter. We're going to start with the sweet, and I'm going to put it on your tongue. I want you to keep your tongue out the whole time. Don't bring it back in your mouth, and tell me where you taste it. I'll stroke a part of it and say, do you taste it there? And just nod yes or no. You don't have to tell me yes or no because your tongue will get back in your mouth, and then you'll be able to taste it everywhere. All right, so first we're going to do sweet. All right. So I'm going to start with the back. Do you taste it there? 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 Okay. We're going to do the middle now. There? There? Okay. There. Okay. One more. There. There. And there. Okay. You can put your tongue back in your mouth. You can also get a drink of water to get that sweetness out of your mouth. So you tasted the sweet all on the posterior portion of your tongue, in the tip of your tongue, in both sides of your tongue, but not really in the middle of your tongue. So you must taste sweet really easily. Do you like sweet things?
Not too much.
Okay, well it might be because you taste them really, really strongly. Okay, next we're going to test sour. And I'm just using some lemon juice for this. Do you feel like you have the sweet taste out of your mouth? Okay. Okay. Do you taste it there? 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 All right. I know this can get sour. Do you taste it there? Okay. There? Okay. There? It's okay. It's hard. Okay. Now just the tip is left. Taste it there? There? It's okay. What about there? Okay. So you don't really taste it in any of the middle parts of your tongue. You can take a drink. But you do really taste it on the back part and the tip. And that's really common to drool while you're tasting sour things because your saliva is getting built up around that. Okay, next we're going to do salty. I'll try not to get too much salt on here because I know it's not the best taste in the world. And I'm just using regular iodized salt for this. Okay? You ready? Okay. Back part of your tongue. There. 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 Okay. Middle. There. 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 Okay. Now tip. There. There. And there. Okay. So you don't really taste it on the back parts of your tongue. Usually bitter is where we taste most in the back part of our tongue, but everyone's different. So the next is bitter. This might be a little uncomfortable, but it depends if you like bitter things or not. I'm using the Angostura bitter for this. Good? All right. I'm going to start with the back. There. There. Okay. There. Okay. It's normal. There. 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 Is it really bitter? Front. Okay. So you pretty much tasted bitter everywhere in your mouth except for the back right part. Take a drink, rinse out your mouth. Okay. Good job. We're all done with that part of the taste. All right, and to test the glossopharyngeal nerve, we just recognize what he tastes on the posterior 1/3 of the tongue, and he did taste sweet, sour, and bitter on the posterior part of his tongue. Okay, next we are going to be testing the glossopharyngeal and the vagus nerves. So first we're going to look at the palate at rest. So get the flashlight and just open your mouth. Stick out your tongue. All right, everything looks normal with his palate at rest. Next, we're going to look at the palatal movement when you say ah.
Ah.
Okay, that looks normal. It lifts a little bit, but it looks good. That also shows the lifting reflex. Okay, next, we can turn off our flashlight. Okay, next we're going to look at the nasal emission in speech. Can you say, my mom is a good mom?
My mom is a good mom.
Okay, we don't notice any nasal emission on those mms. Okay, next, we're going to see if you can... Okay, next, fill your cheeks with air. Now try to stick out your tongue while your cheeks are still puffed with air. So, good. Okay, we're checking to see if the air goes through the nose on that part, and it did not, because he was able to stick out his tongue while also puffing his cheeks out. Okay, next part we are going to test is the vagus nerve. Okay, I need you to inhale deeply and hold your breath with your mouth open, and I'm going to time you. All right, ready? 1, 2, 3, go. Okay, that was good. About 15 seconds. We're going to do that one more time. So inhale deeply and hold your breath with your mouth open. Go. Okay. 15 seconds again. So good. All right, so now you're going to take a deep breath in, and then on the way out, you're going to say, ah, and just let your whole breath say ah until you're out of air. Okay? Ready? Go. Good. It's about 10 seconds. Okay? So next, I'm going to have you inhale deeply, and on the way out, you're going to go and make the S sound. I'll tell you when to go. Okay? Go. Okay, good. About 12 seconds. All right, next, I'm going to have you breathe in, and on exhale, you're going to do zzz, the Z sound. All right? Go. Okay, 10 seconds. Good. All right. So next, I'm just going to have you match my pitch, and you don't have to be a good singer or anything, because I'm not either, but we're just going to do a low, medium, and high. So go a low pitch, go like, ah. Good. So medium, ah. Okay, good. Now we're going to do a high pitch, ah. Good job. Those were normal. All right. Now, can you do just a cough for me? Okay, good and normal. Now, can you just do clear your throat? Okay, sounds good. Okay, the next nerve we're going to test is the spinal accessory. So, I need you to... I'm going to push one side of your head, and you have to maintain the turned head position against resistance, okay? So turn your head to the right or the left. And now turn your head the other side. Good. Okay, now you need to push your head forward against resistance, so just move your head forward. Good. Now can you shrug your shoulders for me? Good. All those were normal. Next, we're going to test the hypoglossal nerve. So can you just stick out your tongue for me? Tongue at rest is very normal. We've looked a lot at the tongue today. Okay. Can you stick your tongue out like this? Good. Can you bring it back in? Good. Retract. Can you lateralize your tongue? So that's when you bring it in and make sure it's kind of flat. Okay, good. All right, so stick out your tongue and lift it up. stick out your tongue and lift it, or lower it. Okay. Normal. Okay. I'm going to put some pressure on this side, and I want you to push your tongue against the inside of your cheek, against my resistance. Okay, good. Other side. Good. And do you feel like that you accomplished all those well? Your strength was up during all those activities?
Yes.
Okay, normal. All right, now I want you to produce ta-ta-ta-ta-ta-ta-ta until I tell you to say stop. 1, 2, 3, go. Okay, good. All right. Now, can you say ka-ka-ka-ka-ka-ka-ka until I say stop? 1, 2, 3, go. Good. All right. Now, we're going to use the pen as a bite block again, and you're going to do the ta and the ka again. Ta is first, so go. Okay, good. All right. Now you're going to do ka-ka-ka-ka with the bite block. 1, 2, 3, go. Good. You did both of those for 5 seconds as well. All right. Next, you're going to do patika, 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 patika until I say stop. Go.
Patika, 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 patika.
Good. All right. Next, we're going to do that with the bite block, which might be a little bit more difficult. Okay. Go. Good. That one's a little bit harder because you have the bite block in your mouth. Good. Still sustain it for 5 seconds. Okay.